Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today. So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
We should take care even when we are feeling fine, because if we do not care about hypertension, we will suffer from complications of heart disease, kidney disease, and vascular diseases later on in older age.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Because when there is hypertension for a long time, this is going to cause complications. This will involve stroke and blood pressure and peripheral vascular disease, which will ultimately kill you. So that is why it is known as a silent killer.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
See, it is a combination of lifestyle, genetics, and other factors also like kidney disease and hormonal changes. Majority of the patients are primary hypertensives, which is associated with genes and lifestyle changes.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
See, as far as the American Heart Association goes, blood pressure more than 130 by 80 should not be there, and 130 by 80 above the blood pressure is considered as hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
The first thing they should do is they should reduce their salt. They should have a regular, proper, controlled diet. They should avoid sedentary lifestyle. They should reduce their salt. They should go for a regular morning walk. They should avoid fried foods and spicy foods, and have more of fibers and lean meat, and diets which are more in less in fats and more in fibers.
Can we say that hypertension can be treated without medication?
Mild hypertension to some extent can be treated without antihypertensive treatments. This can be done by lifestyle changes and dietary changes.
Okay, doctor, you just talked about medication right now. So I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
For medications for BP, people should look out for the reduction in the sodium levels, the reduction in the heart rate. There can be giddiness, there can be peripheral vascular disease, and there can be a dry cough also in certain medications. So we should look out for these changes.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Generally, it is a lifelong commitment because it's a primary hypertension which is associated with your genetics and your lifestyle. But in certain cases, we are able to reduce the medications to some extent, ultimately, but they might need medications later.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
When you initially find that you are hypertensive, you should check your blood pressure twice a day. When the blood pressure is controlled, then you can check it every 3 or 4 days, that is twice a day.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.